covering Oxnard, Long Beach, Corona, and all of Southern California. This is Eyewitness News.
Just about every woman has a part of the body where they think they gain weight the most, but for some it can be a serious condition.
And no amount of diet and exercise can help distribute this excess fat more evenly, but now there's a new treatment. Health specialist Denise Dedore is here to tell us more about lipedema.
Yes, it's very frustrating and potentially dangerous. Lipedema affects about 11% of women. It causes fat to be distributed in an irregular way, landing mostly on the hips and legs. Although it begins as a cosmetic concern, it can eventually cause pain and other health problems. Now doctors are using a new procedure to help restore balance.
45-year-old Victoria Albano knows what some people think when they see her, that she just gave up on herself.
And all this working out and exercising and all this taking care of myself wasn't doing anything.
When she was in her 30s, Victoria noticed her arms and especially her legs were getting disproportionately bigger. No one knew why until a doctor treating her for an unrelated injury said the word lipedema, a genetic issue affecting the tissue in her limbs. No one is sure what causes it, but doctors think female hormones play a role because it affects mostly women and it can worsen at puberty, pregnancy, and menopause.
Lipedema can get bad enough where the patient is basically bedbound.
The buildup and blockage can prevent proper draining of lymph fluid, which can lead to infections, delayed wound healing, and loss of leg function. Treatments include manual lymphatic drainage, which is like therapeutic massage, and the use of stretch bandages for compression. Now, Dr. David Greuner is using a new liposuction-like procedure to remove the dysfunctional fat cells, making small incisions in the legs. Doctors can first flush the fat, then vacuum it away, while leaving the vessels intact.
We can't remove all the lipidematous fat. Okay, it's not possible, but we can significantly decrease the burden.
Victoria will have her surgery soon.
I'm very excited, very excited.
Excited to get her life and her limbs back.
And once the patient has this procedure, it can take 18 months, a year to 18 months to see the full effect of the slimming. It's called tumescent liposparing liposuction, and doctors also say certain lymphedema patients who suffer swollen arms because of breast cancer surgery may benefit from the procedure as well. And doctors say this is the only procedure that they believe will last long term.
Oh, that'd be great.
Okay.
Thanks, Denise.
Thanks.